In last year's Pennsylvania budget, pregnancy resource centers were cut off from the state funding for the first time in 30 years.
Today, these centers announced a new statewide collaborative to organize government efforts. Our Pennsylvania correspondent for Erie News Now, Kara Jeffers, is joining us live from Harrisburg tonight with the very latest. Kara, good evening.
Good evening, Mike and Eva. 1993, Pennsylvania Governor Bob Casey passed the Pregnancy and Parent Support System program. He said that if we're going to be funding abortions, we should also be funding alternatives. Pregnancy resource centers play a critical role in that alternative part, though there's plenty of controversy on if they do it well. Here's how they're planning to organize this year legislatively.
Dozens of women, men, and infants lined the stage at a press conference today, announcing the Pennsylvania Pregnancy Wellness Collaborative.
So we just felt like it was time to bring these various centers together that have various services, but all kind of have the same kind of service model, and bring them together into one collaborative so that we could come to Harrisburg with one voice.
The group will advocate for pregnancy resource centers, which are facing their first year with no state funding.
We're hoping that this year, in some way, we can put back some of the funding for our real alternative centers.
Pregnancy resource centers are fiercely loved and hated. Organizations offer medical services like ultrasounds and STD testing, but also parenting classes, diapers and formula, and counseling.
Abortion is never the remedy. We see women with very complex circumstances, very challenging circumstances, and after an abortion, they return to that same situation. Nothing has changed.
Planned Parenthood says the group spread misinformation and propaganda about reproductive health, saying, quote, "For years they siphoned public funding away from real medical providers and used it to promulgate an extremely anti-abortion agenda." The centers maintain they offer real alternatives to a false choice.
When we address the context and begin to care for her unique challenges, she is free then to make a choice for life.
At the heart of this controversy really is these resource centers. They're offering this holistic support for all through the pregnancy, but you have organizations like Planned Parenthood who look at the medical side of what they're doing and say it's not up to snuff, there's not enough regulations, licensing that is going on, or that there might be misleading information in that. When you talk to some of these resource centers, they say that they have made advancements and improvements in the way that they operate with medical staff and the way that they operate with that. In Harrisburg, I'm Kara Jeffers, Erie News Now.
Kara, thanks. Now, birth